two imaging differential diagnoses just to sort of show you that maybe some things can sound very similar and have some differences to them. Great. I have two different CT scans here, right? The bone is very bright and the resolution is not great. So this is CT scan. And all I'm telling you in the vignette is this is a 70-year-old female who has forgetfulness, incontinence, and ataxia. What's sort of one of the diagnoses that jumps to mind with that? NPH. Great. So left or right, NPH? I'm sorry, we'll do, let me annotate these. This will be my left, this will be my right. Ventricles are about the same size in both. They're pretty big. Yeah, Harmon says the left. What do we think the right is? Harmon says the right is Alzheimer's. So I agree. I might not say Alzheimer's in particular, but so this is normal pressure hydrocephalus on the left, right? And so this over here is hydrocephalus ex vacuo, right? And so this is sort of the word we use for when there's so much volume loss to the brain that the ventricles look huge. If you look over here, the ventricles are big, but the brain kind of reaches out to the edge, right? The sulci and gyri are pretty normal versus here, right? We've got it kind of moving away from the edge. These are pretty deep. There's lots of CSF showing throughout. So these ventricles look big because the brain around them has shrunk. These ventricles are big because there's too much fluid and they're causing pressure pushing things out. Does that make sense? So left, normal pressure hydrocephalus, right, hydrocephalus ex vacuo. Anyone with dementia can have forgetfulness, they can have incontinence, and then ataxia is sort of non-specific, right? You can have difficulty with movements for a lot of reasons. So you should think neuro NPH with that sort of, but I want you to know that it could be something else. And this is a good imaging differential.